Welcome to the Developmental Disabilities Administration's first Waiver Advisory Council meeting. We are excited to kick off this new council and the important work that it will be doing. My name is Rhonda Workman. I am the Director of Federal Programs at the Developmental Disabilities Administration. As per the charter, I will be one of the council's co-chairs, and I look forward to working with each of you. Next slide, please. This slide is an overview of our agenda today. It includes a welcome and some housekeeping information, introduction of members, membership recruitment discussion, committee member supports, purpose and review of the charter. A charter is a document that states a team's or council's mission, scope of work, and roles. We'll also talk about the nomination process for voting co-chairs. We'll talk about a formation of a waiver recommendation work group, touch on some ideals for our future meetings, and then open up for public comment. Next slide, please.
Welcome. Good afternoon, everyone. Thank you for joining us today. My name is Marlena Hutchinson. I'm the Deputy Secretary for the Developmental Disabilities Administration. We are very excited about hosting our very first Waiver Advisory Council and are looking forward to some great conversations. We have a lot to cover, so I'm going to turn it back over to our chair, Ms. Rhonda Workman, so that we can get the program started. Rhonda?
Great. Thank you, Deputy Secretary Hutchinson. We'll go to the next slide. Our next slide is about housekeeping, and I'm going to turn it over to our Chief of Staff, Will, to share some information.
Good afternoon, everyone, and thank you for joining. I just have a few quick notes about housekeeping for this meeting. So first of all, please note that the meeting is being recorded and transcribed. Second of all, please mute your device. To mute your microphone, you can click on the image of a microphone located at the bottom of the screen. Next, for questions and comments, please use the chat or use the raise hand feature. To raise your hand in Google Meet, click on the image of a hand at the bottom of your screen. Please note that to speak during the main portion of the meeting, you must first be recognized by the chair. In this meeting, the chair is Rhonda Workman, and in future meetings, there will be two chairs. Members of the Waiver Advisory Council can be recognized during the meeting, and we ask that members of the public wait to be recognized during the public comment period at the end of the meeting. We also ask that when you speak, you introduce yourself prior to speaking, and that when you speak, if you could come on camera. To come on camera, you can click the icon of a camera at the bottom of your screen. Please also note that to ensure confidentiality, if you have a question specific to a particular case at the DDA, we ask that you contact your DDA regional office directly. I'll go ahead and turn it back over to Rhonda Workman.
Great. Thank you so much, Will. Next slide, please. Now I'm excited to start us off with the introduction of our members. So the Waiver Advisory Council is comprised of 33 voting members and at least 13 non-voting members, including state departments, legislator, and national association. Next slide, please. So please join me in welcoming our members with lived experiences. As I share your name, please come off the camera so we can meet you. First, we'd like to introduce John Paul LaValle. John Paul, are you
John
able
Paul
to?
LaValle.
LaValle, I'm sorry,
LaValle.
John.
Sorry, I'm here.
Hi, John. Thank you. And I apologize. I will do my best to pronounce names and get better at it as we kind of go forward.
Thank you.
Thank you, John. Our next member with lived experience is Michael Greiner. Michael, are you able to come on camera? Okay. We'll move forward, and Michael, if you're able to, let us know. The next person is Jessica Salmon. Okay. Our next person with lived experience is Alexander Fitzgerald. Alexander, are you able to come on camera? Yep.
Hello.
Hi, Alexandra. Thank you. The next person we'd like to introduce is Charlotte Whittaker.
Hi, yes.
Hi, Charlotte. Thank you for joining us today.
Thank you for having me.
Our next person is Kelly Cooper. Unfortunately, Kelly has a conflict today that she let us know, so we'll look forward to meeting her in the next meeting. And our next participant, person with lived experience, is Emily Rowe. Emily, are you able to come on and say hi?
Hi, nice meeting you all.
Hi, Emily. Thank you.
Thank you for having me.
Absolutely. So the council does have additional openings for people with lived experiences, and we will be discussing recruitment strategies a little bit later in our agenda. So now we'd like to turn and start to welcome our family members. And as I share your name, if you could please come on camera so we can meet you, that would be fantastic. Representing families of participants that use the self-direction service model, we have Beth Benavides. Beth? Are you able to come on camera, Beth? Okay, we'll circle back to Beth. And then we also have Martin Baker. Okay, we will regroup with that. Representing our families of participants that use traditional service model, we have Stephanie Eckert. Stephanie, are you able to come on screen so we can say hi?
Hi, thank you so much for having me.
Yep, thank you, Stephanie. And we also have Dr. Lisa Thomas.
Good afternoon, everyone.
Good afternoon, Dr. Thomas. Thank you for joining us. Next slide, please. Now we would like to welcome our DDA providers. So as I share your name, please come on camera so we can also meet you. Representing licensed providers, we have Rob Baynard from Opportunities Incorporated.
Good afternoon, everybody.
Good afternoon, Robert. We also have Nala Nordem from Rock Creek Foundation. Okay. Representing our certified providers, we have Karen Lee from SEEK.
I'm so sorry, Rhonda. I couldn't find the unmute button. Hi, I'm Najla Wortham from Rock Creek Foundation.
Thank you, Najla.
You're welcome.
Great. Karen Lee, are you on today joining us?
Hi, Karen Lee from SEEK.
Thank you,
Thank
Karen.
you for having me.
Absolutely. And we also have Matthew Ramsey from Target. Okay. It's important to note that these DDA providers that we've introduced offer a variety of both licensed and certified services. And so we're really grateful for their participation and interest in the Advisory Council. Representing our coordination of community services, we have Teresa Titus from the Coordinating Center. Teresa, are you able to come on screen and say hi for us?
Hi, great to be here.
Thank you. And also representing coordination and community services, we have Caitlin Bishop from Worcester County Health Department.
Hey guys, happy to be here. Thank you for having me.
Thank you, Caitlin. And representing our financial management and counseling services providers, we have Matt Morgan from the ARC of Central Chesapeake Region. Unfortunately, Matt had a conflict and let us know he was unable to join us today. Next slide, please. Now we'd like to welcome our advocacy group representatives. As I share your name, please come on camera so we can meet you. First, we'd like to introduce Asbab Adari, sorry for mispronouncing your name, as our representative for a Maryland ethnic advocacy group. We know he also works as an active member of the Maryland Equity Coalition for People with Disabilities. If you're able to come on screen, that would be great.
Good afternoon. My name is Azib Aderi. Thank you.
Yep, thank you. And we also have Maureen Van Stone representing the Maryland Center for Developmental Disabilities. Okay. We also have Rachel London representing the Maryland Developmental Disabilities Council.
Good afternoon, everyone.
Thank you, Rachel. And we have Stephanie Watkins representing the Self-Directed Advocacy Network of Maryland.
Hi, everybody.
Hi, Stephanie. And then we also have Marlo Lemon representing Parents Place of Maryland.
Good afternoon, everyone.
Good afternoon. Next slide, please. We are also honored to have Delegate Emily Shetty joining us today. Delegate Shetty, please feel free to share a few words if you'd like.
Hi, everyone. I'm so sorry my camera's not functioning on Google Meets lately. It's really great to be here with you all. I'm honored to join you.
Thank you so much. We're so grateful for your time. We'd like to go to the next slide, please. Next, we'd like to welcome our state agency representatives. The people that will be announcing next will all be non-voting members. And as I share your name, please come on camera and share your role at your department. We'd first like to introduce Nan Brittingham, representing the Maryland Department of Disabilities.
Good afternoon, everyone. I am Director of Constituent Services at the Maryland Department of Disabilities.
Thank you, Nan. We also have Danielle Meister and or Suzanne Korf that would be representing the Maryland Department of Housing and Community Development.
Hi, everyone. I'm Suzanne Korf, the Policy Officer for Homeless Initiatives with Department of Housing and Community Development.
Great. Thank you, Suzanne, for joining us. We also have Dr. Elgar Studstill representing the Maryland Department of Human Services.
Good afternoon, everyone. I'm Alger, and I currently serve as the Executive Director of the Social Services Administration, so responsible for child welfare and adult services across the state of Maryland. Excited to be here.
Thank you so much. And we also have Beth Lash representing the Maryland State Department of Education, Division of Rehabilitation Services.
Hi there. I'm trying to get on camera. Hopefully, I don't know if you can.
Yep.
Here I am. So I'm the Director of Field Services for DOORS. Happy to be here.
Thank you for joining us, Beth. Next slide, please. Now, please join me in welcoming the Maryland Department of Health representatives. I will be representing the Developmental Disabilities Administration. And as I share some of my other partners and colleagues, please come on camera and share your role at the department. First, we have Elisa Jones and Darlena Eglolem representing the Office of Long-Term Services and Supports, our Medicaid office. Elisa, would you like to introduce yourself first? Okay. Darlena, are you able to come on camera and introduce yourself?
Yes. Good afternoon, everyone. My name is Darlena Egolam. I'm from the Office of Long-Term Service and Supports in the Subdirectorate of Community Integration Programs. I'm the supervisor of a new division, the Division of Developmental and Intellectual Disabilities. My particular division serves as the state Medicaid agency, and we're responsible for the administration of the 3 DDA waivers and 1 MSDE waiver. It's nice to meet everyone.
Thank you so much. Next, we have Stephanie O'Day representing the Behavioral Health Administration. Okay. Next, we have Kelly Fox representing the Office of Healthcare Quality.
Hi, everyone. I'm Kelly Fox. I'm the Program Manager of the Developmental Disabilities Unit at OHCQ. Thank you for having me.
Thank you, Kelly. We have 2 representatives from the Office of Eligibility Services, Eligibility Determination Division. First is Keisha Shaw, which I believe she is not available today. And then we also have Patrice Miller. Patrice, are you able to come on and share a little bit about you? Okay. And next we have our representatives from the LTSS Maryland Program Management Office. First, we have Eric Saber. Eric, are you able to come on camera? Hi, Eric. Thank you so much. And we also have Joseph Walburn that's joining us too. Are you available, Joey? Okay, well, thank you. We'll go to our next slide, please. We'd like to also welcome some national advocacy groups that we have represented on the council too. As I share your name, if you're able to join us today, if you could come on camera and share some information regarding your organization's work. First, we have Janine Zolowski, representing the National Association of State Directors of Developmental Disability Services. Janine, were you able to join us today? I believe Janine had some travel conflicts. Next, we have Kate Murray, representing Applied Self-Direction. Kate, are you able to come on and share a little bit about your organization? So welcome all of our members. I know that some people had conflicts today, and we really appreciate your interest and participation in the groups and look forward to working with you more. We'll now go to the next slide, please. So we'd like to have some discussion about membership recruitment. If you go to the next slide, please, Yamanja. We currently have 10 vacant seats for people with lived experiences. These seats are for current and past DDA program participants using the self-direction or traditional services model. We are actively recruiting for people who have or have used traditional or self-directed services. The department has created 2 informational flyers that we've noted on this slide, and links are also posted on the Waiver Advisory Council's dedicated website. We encourage all members and stakeholders to share with people they support and their networks these 2 flyers. We have shared the flyers with some of our key advocacy organizations and asked them to share. We are also asking that the flyers to be shared during the National Core Indicators in-person surveys that are being conducted by Liberty that we'll learn more about soon in future slides. We would like to ask now if any council member would like to raise their hand and share some ideals or advice on how the DDA can further recruit members. To share your ideals as a council member, please raise your hand and we will recognize you. So we're looking if you have any ideals. Stephanie, yes, thank you.
Sorry, I didn't have my microphone on. I'm wondering if you've asked providers to nominate people or ask people that actually live with their residents in the traditional setting and or family members.
Yep,
absolutely.
Yes, Stephanie, that's great. Yep, absolutely. We're encouraging everybody joining us today to share with people that they support, and definitely we'll reach out to our provider association and see if they can help us. We have shared with some of the advocacy groups that support families, and absolutely will continue to do that. Thank you for that suggestion. Karen.
2 advocacy organizations that I don't see represented, and I'm wondering about. One is the ARC of Maryland, which I know works with families of all ages and is been one of our strongest advocacy partners in the state for years. And then also People on the Go, both of which have folks with lived experience that are a part of their boards of directors and part of their workforce. And so I'm thinking that, or wondering and thinking that those are 2 organizations that are oftentimes tasked with advocacy and often tasked with including, and have done a great job of including people with lived experiences and how we tap into them and their knowledge and the bandwidth of their group.
Great, thank you, Karen. Yes, absolutely. We've shared flyers with them, but we will definitely follow up with them to see if there's some additional information or support we can provide so that they can share with their network. Okay, looking, Stephanie, did you have another thought or idea? All right, and I believe, let's see if I can see on my screen. Yes, hang on a second. We'll work on the names here and get it better.
I think.
Is that? Yes,
yeah.
yes.
Sorry about that.
Yep.
I haven't changed it to my name. Yeah, I thought of educational programs such as like Project Search.
Mm-hmm.
You have several individuals there with lived experiences.
Great. Yep. We can reach out to contacts for that. These are great ideas. We really appreciate it. Any other ideas or strategies to help with recruitment for people with lived experiences? Yes, Darlena.
Hi, so I was just thinking, I'm not sure if there has been any sort of social media push, but I'm thinking if there are any sort of support groups on Facebook, especially those sort of private groups, either for the parents where you can advertise this, or a support group for those that are state specific with disabilities. You may want to go in that direction if that's possible.
Great. Thank you so much. Emily.
I would say the Arc of Prince George's County.
Great. That's a great idea. We'll reach out to them. Charlotte.
I was thinking, because I'm always constantly in contact with my service coordinator. I feel like reach out to the service coordinators because they're calling us all the time. And so if they knew certain people, because they're kind of with the participants on a more direct level, they might actually know like certain people to reach out to.
Excellent. Thank you so much. Any other council members would like to share some ideas from recruitment strategies? We appreciate those joining us from the public, putting some ideas in the chat. Okay. We're going to now go forward. Can you go to the next slide, please, Yolanda? Now we would like to share some information about the council member supports that we'll be providing. Next slide, please. To support council members, the DDA will conduct prep meetings to support people with lived experiences and others, council members, in understanding the materials and agenda. The prep meetings will be conducted 1 week prior to the meeting unless otherwise noted. All information will be shared in plain language. The Waiver Advisory Council dedicated website will also include the meeting dates, times, and locations. We'll also post the agenda, the presentation materials, handouts, and meeting recordings. And to support in-person options, meetings will be conducted in different areas around the state. Meeting times may also vary to include some evening times to support council members in terms of that flexibility. And we are also developing a Waiver Advisory Council support request form for members only. This form can be used to request additional support, some accommodations, and share some questions. Next slide, please. We're now going to review the Waiver Advisory Council purpose and the charter. Next slide, please. The purpose of the Developmental Disabilities Administration Waiver Advisory Council is to create meaningful engagement and a feedback loop with all interested stakeholders, with a focus on people with lived experiences. Members will have the opportunity to advise and provide recommendations to the DDA on system design, service delivery, and quality enhancement strategies for the DDA-operated Medicaid waiver programs. Next slide, please. The Waiver Advisory Council is charged with providing input on the DDA-operated Medicaid waiver program system design, service delivery and access to services, federal waiver assurances, ensuring access to Medicaid services, also referred to as the access role, and quality enhancement efforts and improvement strategies. We're going to provide an overview of these areas in our next slides. Next slide, please. First is the DDA-operated Medicaid waiver program system design. The DDA operates 3 Medicaid home and community-based service waiver programs. This includes the Community Pathways Waiver, the Community Supports Waiver, and the Family Supports Waiver. This means the DDA is responsible for day-to-day operations on behalf of Maryland Medicaid. A Medicaid waiver program must first be approved by the Federal Center for Medicare and Medicaid Services, sometimes referred to as CMS, and allows states to make exceptions to the usual rules. This means Medicaid and other home and community-based services can be provided in different settings, tailored to individuals with different needs or varying income levels. For those who qualify, these programs offer services within people's homes and communities as an alternative to receiving them in an institution. To be eligible, applicants must meet specific technical, medical, and financial criteria initially and on an ongoing basis. For the December council meeting, the National Association of State Directors of Developmental Disability Services will be sharing a presentation for the council on Medicaid. The council also includes some DDA and Medicaid subject matter experts that can also assist with the council with questions related to Medicaid. Next slide, please. The second area that the charge is relates to service delivery and access to services. The DDA-operated Medicaid waiver programs include 2 service delivery models. They are referred to as the self-direction and traditional service models. In the self-direction service model, the participant is the employer of record. They hire, train, supervise, and fire their own staff. They have the option to exercise 2 authorities, which includes employer and budget authorities. In the traditional service model, participants select a DDA license or DDA certified providers for the delivery of their authorized services. We will coordinate with Applied Self-Direction for a presentation for council members on Medicaid self-directed services. The council membership includes representation of participants, family members, providers, and advocacy organization for both service models. The DDA also has 4 regional offices that overview day-to-day services and supports. Case managers, known as coordinators of community services, support people in applying for eligibility and enrollment in the DDA-operated Medicaid waiver programs. They also support participants with facilitating the development of a person-centered plan, referrals to community resources and programs, and conduct face-to-face monitoring visits. Some Medicaid waiver program services require electronic visit verification, also known as EVV. Electronic visit verification is the technology that electronically verifies that services are delivered at the right time, in the right place, and to the right person. Under the Maryland Department of Health's DDA-operated Medicaid waiver programs, electronic visit verification is required for both service delivery models for personal support services and respite care services. The council also includes representation from the Eligibility Determination Division, also known as EDD. The Eligibility Determination Division conducts and determines Medicaid financial eligibility and financial redeterminations for the DDA-operated Medicaid waiver programs. The Office of Healthcare Quality, also a member on the council, known as OHCQ, licenses providers and conducts investigations of critical incidents, like incidents of abuse, neglect, exploitation, and death. The department uses LTSS Maryland, which is an electronic data management system developed and supported by the department. It is used to create, review, and maintain records. For example, records related to eligibility status for services, the participant person-centered plan, services and funding authorized by the DDA. And the council also includes representation from the department's LTSS Maryland team. They can also assist the council with questions. So this is just an overview of the service delivery system for which the DDA-operated Medicaid waiver programs are in. Next slide, please. This slide relates to federal waiver assurances, another focus area of the council noted in the chart. In order for the federal government to approve a new Medicaid waiver program or the renewal of an approved Medicaid waiver program, a state must make certain assurances, like a promise, concerning the operation of the waiver. These assurances are spelled out in federal regulations. The state must agree it will meet these assurances during the period that the waiver program is in effect. Federal assurance categories include administrative authority, level of care, service plan, qualified providers, health and welfare, and financial accountability. Each have specific performance measures. We will share additional information regarding these assurances and performance measures in future meetings. Performance is reviewed and assessed by the DDA and various partners, including the Office of Healthcare Quality and a contracted quality improvement organization, also known as a QIO. A QIO, or a QIO-like, is an organization approved by the federal government as meeting the requirements for review of Medicaid claims and quality of care. Quality improvement means a focus on activities to improve performance above minimum standards and reasonably expected levels of performance, quality, and practice. The DDA-operated Medicaid waiver program, QIO, is Liberty Healthcare. In a future meeting, Liberty Healthcare will also share a presentation of their work and role. Next slide, please. This slide relates to ensuring access to Medicaid services. A new federal rule was issued by the Center for Medicare and Medicaid Services. The rule is titled Ensuring Access to Medicaid Services Final Rule. It's also referred to as the Access Rule. The Access Rule purpose is to help with access to Medicaid services and quality of care and improve health outcomes of Medicaid beneficiaries of home and community-based service delivery systems. Another way to understand the Access Rule is to think that the rule is about Medicaid applicants and participants' rights and the rules agencies must follow when they work with Medicaid participants. The Access Rule has several focus areas. Each area has a specific time frame for which requirements must be met. Most of these requirements are several years out for when they have to be implemented. A future council meeting will also include a presentation on the Access Rule. Next slide, please. The next focus area we want to touch base on is quality enhancement efforts and improvement strategies. The department is committed to continuous quality improvement of services and processes. Previous strategies and recommendations related to quality enhancement and improvement strategies have been recommended by the DDA Quality Advisory Council, Coordination of Community Services Providers, the Developmental Disability Coalition, the Maryland Developmental Disabilities Council, advocacy groups, and Liberty Healthcare. Next slide, please. As per the council's charter, we also have some guiding principles. They include person-centered thinking. This means outcomes and processes are person-driven, recognizing the unique needs of people who receive or may receive services. Another guiding principle is diversity, equity, and inclusion of principles, such as consideration of all voices, system-level thinking to promote equity and eliminate biases, promotion of diverse viewpoints, and member representation that reflects all people receiving services and people who support them. Evidence-based, data-driven, and solution-focused is another guiding principle. This means discussions, problem-solving, and recommendations are based on research and data. Commitment to continuous quality improvement, collective responsibility, and goal alignment is the last guiding principle. Next slide, please. As per the charter, the structure of the meetings include all meetings will be goal-driven. This means we'll follow agendas set ahead of the meeting and will end with a clear understanding of expectations and assignments for future steps. Meetings will be held in person with a virtual option. Meetings will be held bi-monthly. We are looking at scheduling meetings the third Thursday of the month. The meeting place will be published at least 2 weeks before each meeting. As needed, off-cycle meetings may be held if deemed necessary by the co-chairs. Travel arrangements may be made for people receiving services as necessary. DDA staff will ensure logistical and accessible accommodations are available for meetings. Meetings will be facilitated by 2 co-chairs. As the Director of Federal Programs, I have been noted as one of the co-chairs. The other co-chair will be a member voted on the Waiver Advisory Council. Subwork groups may meet as indicated and directed by the co-chairs. And after all meeting agenda items have been addressed, time will be provided at the end of the meeting for public comment. Next slide, please. This slide relates to communication as noted in the charter. Waiver Advisory Council members will be informed of meetings through emails. Documents will be shared with the Waiver Advisory Council at least 1 week prior to the meeting to provide time to review. Meeting minutes will be distributed to the Waiver Advisory Council within 2 weeks after the meetings. Meeting times, dates, agendas, and other meeting documents will be posted publicly on a dedicated DDA Waiver Advisory Council webpage. If a schedule change is required, it will be communicated to the full council and the public as soon as possible. Waiver Advisory Council meetings will be recorded and posted to the dedicated DDA Waiver Advisory Council webpage after the meetings. Documents will be made accessible for all members and the general public. Next slide, please. As a new committee, it is important to talk about how we're going to work together. Sometimes this is referred to as ground rules. Common ground rules include things like being respectful of other participants, not interrupting, and staying on topic. DDA's Waiver Advisory Council ground rules are also noted in the charter. They include assume a positive intent, speak one at a time, so we want to refrain from interrupting others. Speak in plain language. For example, try not to use acronyms. Share information openly, promptly, and respectfully. Listen to others' point of view and try to understand other interests. And remain flexible and open-minded and actively participate in meetings. Next slide, please. The Waiver Advisory Council group will include an equal number of members that serve for 2 years and members that serve for 3 years. After the first group, subsequent group of Waiver Advisory Council members will serve for 3 years. This will help to support members to rotate out instead of changing the makeup of the full Waiver Advisory Council every 3 years. New member selection will be based on the application and review process. Members may not be immediately reappointed at the end of their term, but may serve multiple non-consecutive terms. And membership terms will be noted on the website with the membership list. Next slide, please. As council members, we have agreements that are noted in the charter. So council members must agree to the following: arrive at each meeting on time, actively participate at each meeting and collaborate to find solutions to problems, attend all meetings possible. If a member is not available to make a meeting, the member will send a proxy in their place, someone who's familiar with the work of the waiver and the advisory council. A proxy is someone who can fill in when the council member is absent. Review documents promptly in advance of each meeting and be prepared for discussions. Complete all necessary assignments prior to each meeting. Share their ideals based on their role they represent. Act as a liaison, sharing information and feedback between their respective stakeholder groups and communities and DDA. Maintain a solution-directed and outcome-directed focus. We're here to talk about opportunities and be creative and innovative and present recommendations to DDA. Next slide, please. Co-chairs will agree to effectively manage meetings and ensure resources are available to adequately manage meeting logistics. Ensure that all members who wish to have an opportunity to speak are encouraged to do so. Promote collaboration and exchange of ideals among Waiver Advisory Council members. Facilitate communication with subject matter experts and other groups as indicated. Keep the Waiver Advisory Council members informed of progress. Provide Waiver Advisory Council members the opportunity to collaborate on making recommendations for DDA. Provide technical expertise. Take the group's feedback, perspectives to consider and include when making final decisions, and explain the reasons for accepting, not accepting, or accepting with amendments on recommendations, and being open and transparent when sharing information and decisions. Next slide, please. The charter also includes information on recommendations for the DDA. The Waiver Advisory Council is primarily advisory and cannot vote for the DDA to take any action. The Waiver Advisory Council's decision-making authority is limited to voting on advice to submit to the DDA. Members will strive to reach agreement by consensus at a level that indicates that all partners are willing to live with the proposed action. All Waiver Advisory Council members have an equal voice and will be listened to. If agreement cannot be reached on a particular issue, the Waiver Advisory Council may take a vote with a majority agreement based on filled seats. The Waiver Advisory Council members or their designated proxy must be present at the meeting, including members or proxies who are attending in person or virtually, in order to vote. Council members cannot vote on behalf of another member, or voting cannot take place out of the meeting. A member's proxy may vote on a member's behalf if they are attending a meeting for the member. A member's proxy may not vote on their own behalf. Council members will strive to work expediently, so as fast as we can, and try to avoid revisiting decisions once made. Next slide, please. So this slide is about the nomination process for voting co-chairs. We would now like to discuss this process. Voting council members can volunteer to be the co-chair or nominate another voting member. A co-chair form will be sent out to all members that can be completed within the next 2 weeks. Another form will be sent out to voting members to vote on the co-chairs. The nomination of the co-chair will be announced prior to the next meeting. So again, we are creating a form that we will send out to the council members so that if you're interested on volunteering or nominating someone to be a co-chair, you would indicate it in the form. Based on the information we receive, we will then share the entire list with the council members so that you can vote on your co-chair, and we'll announce that co-chair that was nominated prior to our next meeting. Next slide, please. This slide relates to a work group to be formed, the Waiver Recommendation Work Group. We know that council members and the people and groups that they represent have suggestions and ideals on changes or improvements for the DDA-operated Medicaid waiver programs. We are seeking a volunteer or volunteers, council members, to facilitate a work group to start to develop ideals and recommendations for changes and improvements to the DDA-operated Medicaid waiver programs. Changes to Medicaid waiver programs are submitted to the federal government as an amendment to the current waiver program application. Work group members can work with the people they represent and networks to also develop and bring ideals to the waiver recommendation work group. The work group can then share recommendation to the council in the February meeting for some consideration. We would like to open up this discussion to include seeking a volunteer or volunteers that would be interested in facilitating the waiver recommendation work group. Please raise your hand if you'd like to speak, to volunteer, and we will call on you. Stephanie.
Can I make sure that you announce what all of the work groups are going to be before you ask for volunteers? Because it's kind of hard to know like what the other work groups might be.
Yeah, that's I think that's a great point. This is, yep, sorry, go ahead.
No, that's all.
Okay. This is the only work group that we're seeking for today. So we know that people are very excited and interested in participating in the Waiver Advisory Council and have some great ideas about strategies and services and improvements to the DDA-operated Medicaid waiver programs. So this group would start those discussions to look at services, supports, waiver processes, the service delivery models, including the self-direction model, the traditional model, can look at and consider the employee, vendor, and provider qualifications that are noted in the approved waiver, and then other areas. Charlotte.
I would definitely be like interested in trying to help working with this and come up with new ideas. Yeah.
Excellent. Charlotte, are you interested in participating or maybe helping to kind of chair and facilitate the group?
I'm interested in sharing, yeah, and help facilitate, definitely.
Great, thank you. All right, Jessica.
Hello, everyone. I'm interested in sharing and or facilitating in the group as well.
Excellent. Thank you so much, Jessica. Stephanie.
I am definitely interested in participating and would consider chairing. It just depends on what you think the time commitment will be, to be honest.
Okay, great. All right, other council members.
Rhonda, this is Karen. I just have a question. Will there be support for council members that may not be typers or writers to help them to be able to express themselves? Or are you looking for people who can independently put forward a document?
We're looking for a work group that would work outside the council. We want to encourage and support all individuals to participate. So if somebody needed some assistance, we could look to see what kind of supports we could help with to provide that.
Thank you.
Mm-hmm. Robert.
Hello, Rhonda. A question that we have in the chat. Can non-members participate in the work group?
Yeah, that's a great question. The waiver work group or waiver recommendation work group would be a subgroup of the council. And I think council members would then be working with their networks, their peers, other stakeholders who are non-members to kind of grab that information, gather that information, and share that. Stephanie Watson.
Sorry, I just forgot to unraise my hand.
Okay, great. Stephanie Eckert. Stephanie Eckert.
I'm so sorry, I didn't unmute. I would be interested in participating on this work group.
Okay.
Thank you.
Okay. And Beth, your hand's up.
Yes, I would like to participate.
Okay. Great. And Teresa. Teresa Howard.
Hi, yes, I'd be happy to participate.
Great. Karen.
I'm happy to participate as well, and I could support somebody as a if somebody who does not have good or efficient typing skills to be their support as well.
Thank you so much, Karen. That's really appreciated. Rob.
Yes, hi, thank you. I'd be happy to participate in this work group as well.
Excellent. Okay. Teresa, your hand's still up. Did you want to? Okay. Caitlin.
Hey, yeah, I would be interested in participating.
Excellent. Thank you so much, Caitlin. Great. Glad to have our coordination of community services there. Alexander.
Okay.
You're interested too? Great. We appreciate that. Rachel.
Me too.
Okay. Thank you, Rachel. Appreciate that. Other council members.
Hi, Rhonda. I'm sorry, Najla Wortham here. I'm not sure if there are still members needed to participate, but I would be willing to participate as well.
Absolutely. Thank you. Other council members.
Azib. This is Azib. Oh, sorry.
Azib. Excellent. Thank you, Azib.
Oh, I'm John Paul. I just had a question. I'm also, so my question is, how long will the term be to be the other chair?
Yeah, so I think it sounds like I've heard at least 3 people that were interested in kind of chairing that or co-chairing that. So I think that the group can get together and then you can talk as a group kind of about how you'd like to pull that information together and facilitate that. Maybe you nominate among the group, but it did sound like Charlotte, Jessica, and Stephanie were interested in helping to chair or co-chair and facilitate that. It's October, so we're excited about this group starting to kind of get this information, working internally and also externally, getting feedback from the groups that you represent and others to start to formulate some recommendations and some ideals that could be shared then at the February meeting.
Okay, but how long is the term for? Is it like a 2-year term, a 1-year term?
Okay, that's a good question, John Paul. I'm sorry, I misunderstood your question. So for the Waiver Advisory Council, we have members. Some members will be a 2-year term and some will be 3. So we're looking at that and we will be communicating that and posting the membership's name and their terms on the website. Did that answer your question, John Paul?
Okay, yeah, but for chairing it, would you also have a 3-year term, or will?
No.
How long will that be for?
Well, what we're looking for right now is this group would work from October to February to start to formulate some ideals and input. So that's the initial ask and time frame.
Okay, thank you.
Yep, thank you. Good question. Matthew. Matthew Ramsey.
Yep, I would be interested in serving on this work group.
Great, thank you, Matthew. And Matthew, you're from Target, right?
That's correct.
Right, thank you. Just wanted to introduce since we didn't have that opportunity.
Thank you.
Any other council members? So Jessica.
Hi, yes, I just wanted to say that I see that there's another Jessica on, so people can call me Jay, so we won't get it confused. And then also, I know you said it's a 2-year term and then a 3-year term, but I guess I'm sort of confused about that. I'm not sure if anybody else is confused about that. So is it for council members that it's a 3-year term and non-council members that it's a 2-year term? Or what exactly did you mean by that?
Yeah, absolutely. I am sorry that I'm not communicating this very well. So let me try to do this again. For all voting council members, right, we have a group of 33 individuals. And what we're going to do is have an equal number of council members that are going to be on the council for 2-year term and an equal number that will be on the council for 3-year term. And the reason why we're doing that is because we don't want, after 3 years, for everybody to be transitioning off and start with a full group of new people. So after 2 years, some people will transition off and we'll have new members come on, and they'll be with those members who have the 3-year term. The following year, then the 3-year term people would be transitioning off. So we will be sharing with you and posting on the website your name as a council member, as a voting council member, and note your term, whether it's a 2-year or 3-year. So that's for serving on the Waiver Advisory Council in general. And what we've been talking about is having a work group for the council member work group that would be looking at waiver recommendations. And it sounds like we've got a lot of interest and participation. Other council members that would like to share or participate. And we'll also reflect in our minutes this opportunity for those who may not been able to join us today, so that they also will have that opportunity to join the group if they are interested. Yes, Mr. Baker.
Yeah, I would be interested in helping out with one of the work groups, Rhonda.
Great, thank you so much. We've added you. Welcome. Any other council members? Yes, Deputy Secretary.
No, I just wanted to clarify, we just have the one work group, just so that everybody is aware. And it is going to be time limited based on the projects that we are working on. So we will be very clear about the project right now. This project is for the waiver recommendations work group. It's just one work group. Thank you so much for everyone raising your hands and saying yes to assist us with this. And it is time limited. So more information to follow.
Great, thank you so much. Okay, well, let's transition to our next slide. So future meeting presentations. We are going to have a Medicaid 101 presentation. I mentioned that earlier. We want to make sure that we're all as a council familiar with Medicaid and kind of the rules and structures and flexibilities that are provided under home and community-based waiver services. That presentation will be provided by the National Association of State Directors of Developmental Disability Services. We're also looking to have a presentation on the access rule. We have reached out to a advocacy group and asked if they would be available and interested in sharing information on the access rule. We also talked today about our two service delivery models, and one included the self-direction model. So we're going to be reaching out and coordinating with Applied Self-Direction, which is a national organization associated with self-direction services. Our quality improvement organization, that QIO I was mentioning, Liberty Healthcare, will also reach out to them so that they can present information about our waiver assurances and the reviews that they're conducting currently. And then the waiver recommendations work group that we just talked about, we would look for information and a report out for those ideals in our February meeting. We now would like to open up the discussion to our council members. If they have any additional suggestions about other presentations or information that would be helpful for you and as you do your work. So if you could please raise your hand if you'd like to speak and we'll call on you. So other ideals about presentations for future meetings or information that you feel would be helpful. Rachel, I had a question. Rachel, you want to come on and ask your question?
Sure, sorry, trying to unmute and do everything at the same time. My question was, why isn't there also a presentation on the other service model?
Sure. Do you have any suggestions on a presenter for that? We're happy to, that's what we're looking for ideas. So a presentation related to traditional service models.
To community providers? I think we're trying to move away from traditional services. There was a lot of chat about it.
Okay.
I am happy to make some recommendations. Yes.
Okay, great. Karen.
That was also my recommendation.
Okay, great. That sounds terrific. Other ideals about presentations or information that you feel would be helpful for the council? Stephanie.
Yeah, Rhonda, how will we work if something comes up? Like right now, I don't have anything that comes up to my mind, but as things go on, what do we do? Just tell you and the co-chair that we'd like something?
Yeah, that's a great question. So earlier in our presentation, we talked about having a Waiver Advisory Council support form. So we're going to create a form that you can submit information, questions, ideals, request. So we'll be sharing that with the council so you can do that. We can capture that.
Thank you.
Yeah, it's a great question. Thank you so much. Karen.
So I see the access rule, and I think that with the both CMS and ACL focusing right now so much on the settings rule, and there's such significant parameters around the transition plan and the settings rule, if there might be some space for us to talk about what the direction that CMS is going in and what they're wanting to see from waivers and what the impact of having the settings rule is and having systems think differently about how we support people. So just something about the direction that CMS and ACL are trying to take Medicaid services for people with intellectual and developmental disabilities with the settings rule as a part of that discussion. Do we have anybody who works at DDA that was involved in the transition team, Marlena?
Yes, so Karen, I think that's a great idea. So we'll definitely can look at having some information and presentation on the settings rule and as you mentioned, some of the direction and information that's coming out from CMS and ACL.
And yes, Karen, we do have folks here.
Pen to paper, thank you.
Yeah. Jessica Solomon.
Hi, everyone. So I was sitting here thinking about some things because I advocate on behalf of other people with inside of DDA who gets the services. And one of the big questions is to start doing surveys. So the participants, the members, the clients, whatever you guys want to call them, want to start doing surveys of how do they really like supportive employment. They want people to come out. They want people to come out to check like the day have and to make sure that they are really okay, or to make sure that these people are doing what they're actually supposed to be doing. Because as of right now, it's a disconnect. That's how they're feeling. So how to bring DDA and the clients, the members, whatever you want to call them, closer together. I remember when it was called New Directions, we used to have meetings. We used to go to the central location of DDA, and they used to have meetings with us, or we used to do surveys, or there used to be a conference, a big conference, whereas though the coordinator center, DDA, would bring everybody together. And I think it was called the Self-Determination Conference. And that is some of the feedback that I have gotten. And the disconnect between service coordination, DDA, and the people that they provide. Because another one of the issues that's been brought to my attention is service coordination has changed. It's not the same as back in the day where service coordination used to have a self-advocacy board. I was the president for the Rotunda building, and my service coordinator was Helene Ernson. It's not that where we have our self-advocacy board meetings, or where they're doing parties for us anymore, or taking us out. Like, service coordination has totally changed. And with all these changes within service coordination DDA, the members, or whatever you want to call them, feeling like they haven't gotten what they're used to getting, like information heads up, or the service coordinators don't know about this. And then you'll ask a DDA person and they don't know about that. And then you'll ask the ARC and they'll be like, what are you talking about? Or you may ask if you're not with the ARC. So it's a bunch of disconnect, and it's a bunch of new people, because before we was used to Bernie. It's no longer Bernie. Then they're like, who is this self-directed woman? Because when I was in it a long time ago, we didn't have a self-directed woman. It was no self-directed woman. So it's like the members are really, and I'm about self-directed because the program I'm in, and that's where I'm hearing the complaints from, are really having a hard time.
Well, thank you so much for sharing that. And we can, as a group, look at any recommendations for a survey that could go out to capture some of the information that you're mentioning there. And we really appreciate you sharing your perspective and some of the history of your experiences from that. So going to call on a few others. So we're looking, and our ask is additional information or presentations that would be helpful. Karen.
I would love to hear about how the waiver can help us to address workforce issues and what other states have done in their waivers to address workforce issues.
Okay, workforce issue and strategies, national strategies. Mm-hmm. Okay, great. That's a great idea. Stephanie.
I completely agree with the workforce. I think that's fantastic. And I also, one of the guiding principles you said was for person-centered thinking. And it might be good to maybe have a brief presentation on person-centeredness so that everybody's kind of on the same page and make sure we're all thinking the same thing with that.
Great idea. Yes, thank you so much. Other council members, suggestions, ideals about future meeting presentations or information that would be helpful. And Stephanie, your hand's still up if you had another idea. Okay. Yes, Ms. Fordham.
Oh, hi, Rhonda Wortham. I'm sorry. But I would like a presentation on how other states are addressing waiver services that meet the needs of the dually diagnosed.
Okay.
Thank you.
Great. Council members, any other ideas? And I apologize for slaughtering everybody's name. I will work on it. Beth.
Thank you. I just want to make sure that we have an opportunity to at some point in time address supportive employment, and specifically hoping that we can focus on improvements that can be made related to this, the self-directed model and supported employment.
Okay. And we often refer to our services now as employment services versus the supported employment. But yes, we can look at employment supports and look at national practices and things like that. That's a great idea. Any other ideas about information or presentations that would be helpful for the council? And we can always add more, so it's okay if we don't have them all figured out today. Okay, great. We're going to go to the next slide, please. So we are now going to open up the call for our public comment. Please note to, again, ensure confidentiality. If you have a question specific to an applicant, eligibility, services, we want you to contact the regional office so that we ensure privacy and confidentiality. We want you to raise your hand if you'd like to speak. Each person will have 2 minutes, and will help me in terms of kind of the timing of that. The first hand that I've got in my queue is Michael Greenberg. Mr. Greenberg, if you'd like to come off mute and share your comment.
Hello.
Hello. Yeah, there you are.
Oh, sorry about that. Thank you. Two questions with respect to presentations. Perhaps one on the issue of transitioning youth and a look at the different parties and the way they interact to get individuals into services, specifically EDD and the DDA. I think the transitioning youth, regardless of the service model, would be something that might be worth looking at. So that's a suggestion. And then with respect to the membership for the group, I noted for the self-directed model, there seemed to be good representation from families and from leadership of self-direction. In the community provider or traditional provider, depending on the term you want to use, seemed like there was good representation from families and individual providers. But was there any thought to including leadership representation, such as somebody from Max, since the complexities, and Max would be able to give a broad input into all the providers, not just the individual service providers. So that was really a question.
Well, thank you for sharing your thoughts. We appreciate that. We're going to go to the next person, Adam.
Hi. Yes. Good afternoon. One of the biggest concerns I've seen and I've dealt with myself is timeliness in the processing of eligibility determinations, annual PCPs, modifications, etc., all those different things. What's DDA doing to overcome that? As one of the public statements I've seen regarding that is short staff maybe, or overworked staff. Can we not look at doing something like maybe shifting these things that are done every year to maybe doing them every 2 years to reduce the burdens at the DDA and EDD and other agencies that have a hand in this stuff? So that's the biggest thing I've seen that I'd like to bring up and just kind of get put on the table.
Great. Thank you for sharing that information and your thoughts. A. Johnson, you're next on the list.
Thank you for allowing me to speak. So my question, and I also posted in the chat, is as a person who did apply to be a part of this workforce committee, and also a person who tried to encourage lots of other families and or people with lived experience to apply for this committee, it would be helpful if we could know the criteria that you're actually looking for. I myself am a Black woman. I work primarily with the Black and Brown community. within the state of Maryland. I work a lot with people who speak English as a second language, et cetera, because I'm also a behavior supports provider for DDA, and I also work privately. So my biggest concern, and again, I don't know everyone that's on this call, I don't know everyone's experience that has been chosen to be a part of the community, but my biggest concern, I also want to mention my child, my adult son now, he just turned 18, is nonverbal. And so he's often left out of a lot of these discussions as well. How are you guys ensuring that this committee is actually going to be inclusive of the diversity that is a part of the state of Maryland? Because right now, I will say, as a member of the public, I do not see my son represented right now. And that's a concern for me as to whether or not DDA is actually taking the time to listen to the public and listen to the many concerns that the Black and Brown community faces, the immigrant community faces, the nonverbal community faces, and people with, obscure disabilities as well. My son is one of one in the entire world, for example, with his particular disability. And I don't see him represented right now, so I'm concerned that no one on the committee is going to be able to advocate for people like him appropriately. Thank you.
Great, thank you for sharing. Mary Beth Janzak.
Hi, thank you for the opportunity. I have two things. One is about communication and the fact that there doesn't seem to be a consistent way that the DDA communicates with all individuals, and by all individuals on a team is what I'm speaking to specifically. The participant, the family member, the caregivers, the CCS, the support broker, everyone on the team doesn't seem to be able to receive all of the same information when it comes to changes or just updates. Whether they're changes to the entire system or if it's just specific changes to that particular participant's PCP or budget or modification or clarification. I think that the DDA could do better with their communication in that respect so that everyone remains on the same page. And by everyone, I mean everyone on that participant's team. And then my other question is, recently there's been a lot of talk about the participants of self-directed services and that they are employers and have employer authority, and that there has to be an employee handbook. And I have looked at all the waivers and I cannot find any language in there regarding this employee handbook. And also there's no guidance into what needs to be in this employee handbook. So I would like to know if there's any place to look, or how can I access this information if this is a requirement for the participants as employers to have this employee handbook? Where do I find that information and how do I know what is supposed to be included in that handbook? Time out.
Great, thank you for sharing. Okay, Karina Jones, in my screen, it shows that you've lowered your hand. Did you still want to speak?
Hi, thank you for letting me speak. It's still up.
Okay.
Hi, Rhonda, and to the board. I also applied, but unfortunately, I don't know what's going down. That anybody from the Eastern Shore other than Worcester County, I think, was the only one represented, but that was presented from, like a state agency, but no family person was represented from the Eastern Shore, and that kind of concerns me too. The other thing I wanted to point out, Rhonda, is the situation that's going on is with the REM services and people participants self-directing their service, and they have REM. As everyone knows, there is a huge nursing shortage all across the country. And with that, personal enhanced overnight services are being clarification. Participants are losing staffing because of that, because of DDA. And I just want to make sure that everybody's aware of that, that's on this call, and I'm quite sure you are, on the reason why the clarification. If the participant is in REM, obviously their medical condition is high, but with the personal enhanced rates, the overnight where there's not enough family members have to step in and do it. There's not enough nurses to go around. So I just wanted to bring that to the table. I didn't see anything about nursing on your work group that you were talking about. Transparency is very huge. And I just wanted to bring that out. I just wanted to, hopefully your work group can also look into the REM services, nursing services, and the personal supports enhanced. Okay.
Thank you so much.
Thank you, Rhonda.
Yep.
Appreciate it.
Absolutely. The next person is noted as Monica F.
Hi, good afternoon. Monique F. I am. Thank you for inviting us to this. I too, as a parent of a young adult, applied to be a stakeholder member, if you will, was not, granted access to be on the board. I do echo some of the other comments. The other woman who mentioned my son also is nonverbal, uses alternative communication, as we like to say. And I do think, I haven't heard too many parents, but I do think we have some viewpoints and that it's noteworthy for us to be able to share them with you. So the question I have is, when I got the email saying I wasn't selected, but here's the link for this meeting, will the future meetings be available to parents for us to hear and perhaps provide feedback? If so, how will you communicate those links to attend those meetings? And then I have two other points very quickly. Number one, I would love to have some proven practices, best practices, if at all possible, for the traditional model, and then self-directed, maybe what other families are doing, and if they want to view switching over. But one thing I really would love to at some point get to is respite providers. Sometimes as a caregiver, we really need respite. We want to have our family members that we love with people we can trust, but then we can't just use family members. You have certain ways you have to go about it. So I would like to hopefully learn more if there are any loopholes or ways that we can maximize, because sometimes, that really supports the family. Thank you. And if I can get a response to future meetings, will we get a link before we end? If you haven't stated that already, thank you so much.
Yeah, just a reminder, the DDA has a dedicated website for the Waiver Advisory Council. If you go to that site, you will see all the meeting dates are going to be posted there, including the links. So if you go there today, you'll see today's date, the agenda, and PowerPoint has been posted in addition to the link to the meeting that we shared. So for the next meeting, which will be in December, we'll also post information and the link to that so that all individuals in the public can join. Okay, our next person is Corinne Shannon. Ms. Shannon.
Hi there. Yeah, Corinne. Close enough though. Hi, I'm a support broker. My brother has been in self-direction for quite some time now. I wanted to make the point of I'm quite sure that this is just agency-wide, where we are not notified of changes in policy unless we are denied something that we have requested. That could be anything from a PCP. As a support broker, it's going to be things like reimbursements for health insurance. Mary Beth, I thank you for your comments, because that was so on point. The health insurance reimbursements is a great example, because no one ever told us we needed a handbook. I have literally, I stopped writing an email that I spent 6 hours on this morning because I've been trying to get employees reimbursed for their health care and health insurance that they've been told that they will have since April. And it hasn't happened, because every time I submit, the ARC comes back and says, now there's a new policy and you owe us this document that you didn't know you needed, but now you know you do. I am tired of getting all of my information from word of mouth and from Facebook. And I know that teams are very frustrated, as Mary Beth said. Only getting information by word of mouth. I, as a support broker, as hopefully folks know, we don't have access to the budget, yet it's my job to know what's in the budget, the dollar amounts, and then you know, and then make payments or advise my participant as to what they can do with their money that I'm not allowed to see. Now, you know, and that goes along with we're not. I don't know when a budget has been accepted by the FMCS. How can I do my job when I do that? When something goes into auto extend, now you know, support brokers aren't supposed to be paid. That's another point that I would like the council to address. You know, and at the end of the day, the participants are being denied their budgetary authority and their employer authority.
Thank you so much. We really appreciate, I'm sorry, we've come to your time. So I really appreciate you sharing that information. Our next person is Stephanie Eckert. Stephanie.
Hi, first of all, thank you. This meeting has been really fantastic, and I really look forward to being involved. One of the things that has come up for me as a family member and with my friends that have kids in have adults in services, when you're looking for a provider, it's kind of like you just kind of shoot. It's the shotgun method where whoever will take the kid or the adult. And I guess, I don't know if this is possible, but something to consider is to have a ranking method of evidence-based practices that providers have shown that they actually do them. And then the provider, your website, deal. But frankly, you know, my daughter, unfortunately or fortunately, has moved around a lot. She's in a great place right now. But I've had other family members that just can't believe when they switch providers, the differences and the challenges that are present. So that's all. I was wondering why we couldn't do some sort of, you know, 5-star, 4-star kind of thing. I know that might be a little challenging, but that was my thought. Thank you.
Thank you so much. Irene.
Hello. Hi, my name is Irene Swada. I'm the Executive Director of Choice of Control. I'm a member of the Equity Coalition and on the Department of Disabilities Commission. Aziz Bader is here to represent the Maryland Equity Coalition, which you mentioned early on. So the Equity Coalition, and this is for everyone that's attending, is currently includes 35 entities that represent the Black, Brown, and immigrant communities. I understand that one person can't speak for everyone. So I do hope that there will be continued efforts to represent our diverse communities. Keeping in mind that diversity includes differences in abilities, gender identity, access based on geography, and more. I personally support a lot of people who either have little or no family involvement, and that brings about a greater set of barriers in terms of like access to services, who to talk to, and also, unfortunately, if connected with the wrong people on their team, they are either not in control of the services that they receive, or just have no access, and potentially homelessness. You know, just is very imminent. The other thing real quick is that I want to make sure that, you know, we're all a variety of providers and families and individuals here, and it is possible for all of us to work together. I think that there's a lot of feeling out there that we have to almost like be against each other, with like self-directions, not, you know, I guess being against like provider communities. And I just really feel that there is a way that we can all work together. So that should be more of a focus as well. Okay, thank you.
Great. Thank you so much. Thank you, everybody, for joining us today. It is 2:30, and so we've come to the end of our meeting time. Again, welcome to all the Waiver Advisory Council members. We really appreciate your time today and input. We really look forward to our next meeting. For those of you who have volunteered for the waiver recommendation group, we look forward to your report outs at the February meeting. And we will be following up with you soon with the minutes and information. Thank you, and everybody have a great day.
Thank you.
Thank you.